For millions of people, getting a definitive diagnosis for endometriosis is this incredibly long and frustrating journey. A huge piece of that puzzle is medical imaging. But the big debate, ultrasound versus MRI, is way more complex than just picking a winner. So today, we're going to dig into the source material to see what really makes the difference. First, let's just start with a number that frames this entire problem: 6.7 years. According to the research, that's the average delay between when someone first feels symptoms of endometriosis and when they finally get a diagnosis. Just let that sink in. Nearly 7 years of pain, of confusion, of not knowing what's wrong. That's not just a statistic, that is a massive human cost. And the research is really clear that this delay hurts in two ways. For patients, it's years of suffering that isn't being properly managed. And for the healthcare system, it's a huge strain. More emergency visits, more hospitalizations. The bottom line is, finding a faster, more accurate way to diagnose this is absolutely critical for everyone. Okay, so to make sure we're all on the same page, what exactly is endometriosis? Well, put simply, it's when tissue that acts a lot like the lining of the uterus starts growing in places it's not supposed to be, usually inside the pelvis. And because this tissue responds to your hormones, it can cause inflammation, scarring, and very often a whole lot of pain. So how do doctors solve this diagnostic puzzle? How do they actually see what's going on in there? Well, it really comes down to two main imaging tools: ultrasound, which we'll call US, and magnetic resonance imaging, or as you probably know it, MRI. All right, so here they are, side by side. On the left, you've got the ultrasound. It uses sound waves to get this dynamic, real-time picture with amazing detail. Then on the right is the MRI. It uses powerful magnets to create this really comprehensive, almost panoramic map of the whole pelvic area. And this is where you start to see the trade-offs, right? Ultrasound is pretty accessible, it's affordable, and it gives you incredible resolution. But here's the catch. Its value depends almost completely on the skill of the person doing the scan. MRI, on the other hand, gives you that huge, wide view, and it's a bit more standardized. But it costs more, and it's not as easy to get an appointment for. But here's where the whole story takes a really fascinating turn. The research makes it so clear that the real debate isn't actually US versus MRI. It's all about how the machine is being used. The true difference maker is whether a patient gets a standard, routine scan or one that uses a dedicated protocol specifically designed to hunt for endometriosis. Think of it like this. A routine scan is just a general look around, but a dedicated protocol, that is a specialized investigation. It's done by an expert, it might require some patient prep, like a bowel cleanse to get a clearer picture, and they use these special techniques to see if organs are kind of stuck together, which is a classic sign of this disease. And this quote right here, this really gets to the heart of the matter. Routine scans, which are so often the very first step for a patient, just don't do a very good job of finding endometriosis. The study says it directly, and this massive performance gap is a huge reason for that 6.7-year delay. Stats are one thing, but to see the real-world impact of all this, the source material gives us a perfect case study. So let's follow one patient's journey and see how these different imaging approaches led to completely different results. So the story begins here. The patient shows up with severe pain, and she gets a routine pelvic ultrasound. Now, the scan did find something, a cyst, some fluid, and they thought, okay, that's probably the cause of her pain. But they missed the bigger picture, and her symptoms just wouldn't go away because her pain just kept going. The next step was a dedicated MRI, and the difference was, well, it was night and day. This scan revealed a deep endometriotic lesion that was actually invading the vaginal wall, a critical finding that the first routine ultrasound had completely missed. But the story doesn't even end there. To get that one last crucial detail they needed for surgery planning, they did a third scan, a dedicated MRI-directed ultrasound with an expert operator. And this scan was able to confirm that while the lesion was super close to the bowel, it hadn't actually invaded the muscle wall. That one little piece of information let the surgeon plan a much less invasive operation. That patient's story is just so powerful, right? It shows exactly what can happen when you use the right tool with the right expertise. So now let's zoom out and look at the broader evidence. When you have experts using these dedicated protocols, how do ultrasound and MRI actually stack up head-to-head? And here it is, the study's main conclusion. And it might surprise you. When you really compare apples to apples, so dedicated US versus dedicated MRI,
both done by experts, their overall diagnostic accuracy is remarkably similar. The skill of the user really does level the playing field.
But similar does not mean identical. Each tool has its own superpowers. The research found that expert ultrasound is unbelievably accurate for figuring out the precise depth of bowel wall invasion. But MRI, it's the champion of that big picture view, especially for disease on the pelvic wall or in other, less common spots.
So what does this all mean? Well, after looking at all the evidence, it becomes really clear that the best approach isn't about picking a winner in some ultrasound versus MRI fight. It's about using them together. It's not versus, it's and. So what does the best case scenario actually look like? The source material lays out a pretty clear pathway. First, it starts with relying on local expertise. Go with what your center does best. It absolutely requires close communication between the gynecology and radiology teams. And in an ideal world, you might use an MRI first to get a complete map of the disease, and then follow up with a focused ultrasound to really nail down the details for planning treatment. And this leaves us with one final, really big question. We know now the evidence is overwhelming that expertise is the single most important factor. It's the secret sauce. So the challenge for the future isn't just about building better machines, it's about building better systems. How can we make sure that every single patient, no matter where they are, gets the benefit of an expert-level assessment right from their very first scan? And we can finally put an end to that long 6.7-year wait.